morning, everybody. This is the competency we are going to do today. Competency number 2.4. Enzyme inhibitors हम करेंगे. And we are going to specifically see that how some enzyme inhibitors are acting as therapeutic agents to a clinical problem. And the clinical problem we are taking today is alcoholism, rampant problem, and the incidence is increasing. And we are going to see to treat alcoholism how this drug acts. Disulfiram, also called antabuse. And we are going to see that this is an enzyme inhibitor. Which enzyme and how does it act, that we are going to. And second example we are going to see. And paradoxically here, alcohol itself we are going to see is going to act as a therapeutic agent. First problem, alcohol itself is a culprit. We are going to treat by this drug. And second, there is one clinical condition where alcohol itself acts as a lifesaver, as a therapeutic agent. So first problem we take, but before that, just to outline enormity of the problem. Alcoholism seriously affects liver metabolism. 60 to 70% of all cases of fatty liver, cirrhosis, etc. are due to alcohol intake. And then, of course, you all know tremendous economic and burden and dependence and associated problems. One special point, alcohol is a nutrient as well. 7.2 kilocalories per gram is the energy value. तो अल्कोहलिक को एनर्जी प्रॉब्लम नहीं होती है, बट विटामिन एंड मिनरल डेफिशिएंसीज हो जाती है. मल्टीविटामिन डेफिशिएंसी, mineral deficiency. That is why alcoholic ko, what we call, he is consuming empty calories. So we return to the main topic now, disulfiram. But before that, an outline of alcohol metabolism will be necessary. Alcohol means ethanol. Henceforth, I am going to say ethanol only. Ethanol metabolized by two consecutive reactions. First one produces acetaldehyde. The enzyme is alcohol dehydrogenase. The second one, aldehyde dehydrogenase, catalyzes the second reaction. The first reaction is cytosolic and it is slow, sluggish, as reflected by the Km value. Km value is quite high, means the affinity is low. तो P450 के अंदर ये दोनों रिएक्शन होते हैं. First reaction is slow and sluggish, and the second mitochondrial reaction is very fast. What is the result? The result is that ethanol accumulates, but acetaldehyde does not accumulate. Ethanol, after one or two drinks only, the alcohol dehydrogenase gets saturated and starts following zero order kinetics. तो इससे क्या होगा? इथेनॉल accumulation होगा. The level goes to this much and it decreases very slowly. And this is perceived, high alcohol for a prolonged period of time, this is perceived as a pleasant experience. Acetaldehyde, on the other hand, because of fast speed of the second reaction, it is very rapidly metabolized and doesn't accumulate. Maximum level reached is this much, 20 micromole. All right. So, इससे क्या होगा? Ethanol accumulation perceived as pleasant experience. डाइसल्फीराम का एक्शन डिस्कस करने से पहले one observation. Mongolians, particularly Mongolia is a country, all of you know, they built the largest land empire in the medieval time, fierce fighters. And probably one of the reasons is that alcohol intake is low in them. Even if they want to take alcohol, they cannot. Up to 40% of their soldiers, and now also they cannot take because the second enzyme is defective. Second enzyme, acetyl dehydrogenase. They are a genetic variant of this enzyme, and atypical ALD acetaldehyde is present in up to 40% of the population. And the reaction proceeds very slowly. There is a block, sort of partial or complete. तो क्या होगा इन लोगों के? Acetaldehyde will also start accumulating after one or two drinks. Not only ethanol, but acetaldehyde will also accumulate. Or acetaldehyde, henceforth I will call it toxic acetaldehyde. It has got certain toxic effects we are going to see. So acetaldehyde अगर accumulate होगा, the pleasant experience will be changed to unpleasant experience we are going to see. And this is what disulfiram does. It is pharmacological inhibitor of acetaldehyde dehydrogenase. As a result of it, level of acetaldehyde increases after a few drinks, and we get what we call oriental flush response. These are actually effects of toxic acetaldehyde, vasodilatation, facial flush, tachycardia, and this is perceived as unpleasant experience. So what is antabuse doing? Antabuse means disulfiram. ये pleasant to unpleasant conversion कर देता है. Pleasant because of accumulation of ethanol, unpleasant because of acetaldehyde, also called oriental flush response. But a word of caution before we give this drug. So we have covered the competency, how an enzyme inhibitor is acting as a therapeutic agent to treat the alcoholic. अल्कोहल को ट्रीट करने का बेस्ट क्या वे है? एब्स्टिनेंस, अल्कोहल लेना ही बंद कर दो, सारे इफेक्ट इसकी तो सारी इटियोलॉजी पैथोजेनेसिस सब अपने हाथ में है. तो अगर आप what for an alcoholic takes alcohol for a so called pleasant experience, तो प्लेजेंट को अनप्लेजेंट में कन्वर्ट कर देता है बिकॉज ऑफ ओरिएंटल फ्लश रिस्पॉन्स, बिकॉज ऑफ acetaldehyde accumulation. But as we saw, oriental flush response can be fatal also. So the drug has to be given under strict medical supervision. Now a question, when mixed into unsuspecting alcoholic drink, the alcoholic may die also. It can be fatal also. Why? Because uncontrolled oriental flush response brought about by accumulation of acetaldehyde. Now, the second example we are seeing now is ethanol is acting as a lifesaver. It's a billion so far, a terrorist per se. But in one condition, it is acting as a lifesaver, and the condition is poisoning caused by methanol. C2H5OH, CH3OH, structures resemble, names resemble. So the alcoholic would take this methanol, will take this, consume this methanol unsuspecting. He confuses it with the real stuff and consumes the obnoxious cousin of ethanol. Why? It is metabolized by the same enzyme, alcohol dehydrogenase, aldehyde dehydrogenase, but the intermediates are different. The first intermediate is not acetaldehyde, it is formaldehyde. Second intermediate is not acetate, it is formate. Both are highly toxic. metabolic acidosis, blindness. These are the two I have mentioned, but there are many more also. So methanol poisoning is very dangerous, often fatal also. मिथेनॉल कैसे ट्रीट करेंगे इथेनॉल? दिस इज आवर मिथेनॉल which occupies the active site and gets converted to the toxic intermediate. अगर हम इस पेशेंट को इथेनॉल भी दे दें, high doses of ethanol, ethanol resembles and it will occupy the active site. क्या होगा इससे फिर? The two alternative substrates are competing for the same binding site. So there is a competitive inhibition, competitive displacement of methanol brought about because of two reasons. Ethanol is given in very high doses. और आपको ये पता ही है जितना आप कंसेंट्रेशन सबस्ट्रेट की इंक्रीज करेंगे बाइंडिंग उतनी ही होगी. तो अब इथेनॉल बाइंड्स और मिथेनॉल बाइंडिंग को ये डिस्प्लेस कर देगा. तो मिथेनॉल बाइंडिंग कम होती जाएगी. एंड द सेकंड थिंग इज that ethanol, fortunately, it has got a higher affinity for alcohol dehydrogenase. So it delays formation of toxic metabolites of methanol metabolism. So to save the life, we give very high doses of ethanol. The patient will be drunk, but will remain alive. तो आज हमने दो एग्जाम्पल देखे एट द बैकड्रॉप ऑफ क्लिनिकल प्रॉब्लम एंड दैट इज व्हाट अर्ली क्लिनिकल एक्सपोजर इज ऑल अबाउट. अर्ली क्लिनिकल एक्सपोजर, learning biochemistry through some clinical problems. I give you a few problems. Some more enzyme inhibitors acting as therapeutic agent. Methotrexate, it is used in cancer therapy. Static, the biggest killer disease in the world today arises because of atherosclerosis, MI. So this is a hypocholesterolemic agent. How? Which enzyme? And what is mechanism of action? Then for glaucoma, this drug, allopurinol for gouty arthritis, and then ACE inhibitor, angiotensin converting enzyme. Or is it angiotensinogen? No, angiotensin converting enzyme. So these are, I have, so this table, more are given, 1, 2, 3, 4, 5. These examples we have discussed today. You can go through this table and find out what are the others. So thank you very much. Thanks a lot for your patient hearing. Okay. So we will meet again.